Hello. So now we're going to talk about lower respiratory system diseases. So we're going to start with the bacterial diseases. We're going to talk about pertussis or whooping cough, tuberculosis, typical pneumonia, and atypical pneumonias, and other types that are relevant. Most importantly, Haemophilus influenza pneumonia. So just an overall explanation to what the diseases of the lower respiratory system comprise of. You have bronchitis, and bronchitis is inflammation and infection of the bronchi. They are usually caused by the same viruses as common cold and the flu. And common symptoms of bronchitis include wet or dry cough, fever, sore throat, head and body aches, and fatigue. Bronchiolitis is usually caused by viruses. The prevalence of bronchiolitis is this etiological agent that we're going to talk about later, respiratory syncytial virus, and it's prevalent in infants. Pneumonia affects the air sacs that fill up with fluid and pus, and it lasts longer than bronchitis, and it can lead to more complicated cases such as bacteremia, lung abscesses, kidney failure, or respiratory failure. Okay, so that's why pneumonia is usually more committing than bronchitis. And here we're not talking about bronchitis that have allergic, like asthma type of symptoms. We're really talking about the infectious ones. Okay, so let's start with pertussis. Pertussis is or whooping cough is caused by Bordetella pertussis. This is a gram-negative coccobacillus that produces a capsule, and that capsule allows for attachment of the bacteria where, remember, the cilia of the respiratory system, in the ciliated cells, in the epithelial cells. So what happens is that the bacteria produce something called tracheocytotoxin, and this toxin destroy, so those are the cilia, right, in A. So that's the bacterium destroying the cilia and the epithelial ciliated cells, and that will cause what? What do the cilia do that is so important for our respiratory system? They trap mucus. So without cilia, your mucus is stuck and cannot be, I said trap, but I meant brush. They brush the mucus down to the esophagus. So without that cilia functional, your mucus is stuck there and it doesn't get brushed away from the airway. And with that, it causes a very violent cough. The person coughs to try to eliminate the mucus, but the mucus doesn't move because the cilia are not there. Okay? And because of these deep breaths after each coughing, that results in a whooping sound, that the disease is called whooping cough. Okay? There is another toxin that also messes with the metabolism and the intracellular communication of this epithelial cell, and that's called pertussis toxin. Okay? All this interferes with the functional ability of the respiratory system to eliminate microbes, and the bacteria persists and cause that disease. There is also an ability of this pertussis toxin to downregulate the T cell response, which makes the disease worsen. Okay, and also APC become dysfunctional. The tracheal toxin also works as a pyrogen, causing fever. So you have to prevent this disease by using TDTAP or TDAP for bigger individuals, older individuals, where AP is a cellular pertussis. So these toxins are inactivated, so they don't cause the whooping cough when you take the vaccine, right? What they're going to cause is just a very important reaction in the immune system to recognize and make memory cells against them. There are 3 stages in this disease. Stage 1, which is the catarrhal stage, where you have that secretion growing and accumulating in the airway. The paroxysmal state, where you have the violent coughing and the gasping for air. And the convalescent stage, where you're waiting for that cilia and for that epithelium to repopulate, and you can get your cilia back, but that takes time. Okay, may last more than a month. I really like this graph because it shows you the number of cases of pertussis between 1922 and 2018, and it shows you how the vaccines, see, they started with one vaccine here in the 1940s, and then with the vaccine, look how much of a decrease you had in the cases. Okay, and then with the DTaP, it just kept that number really low, but then there was an increase. You see this bump here? So in the last 20 years, 15,000 cases reported in the US in 2018, 2019, because adults were not getting vaccinated. And that's when they introduced the Tdap to try to decrease that number of cases. It's important to notice, you say, why this disease is not eradicated? Remember that there's still a lot of people that don't take vaccines. And that's why you cannot reach herd immunity, so you allow the bacterium to continue to circulate in the population. So now let's talk about tuberculosis. Tuberculosis is one of the most important diseases of the lower respiratory system. It's caused mostly by Mycobacterium tuberculosis, but can also be caused by acid-fast other Mycobacterium species that are also acid-fast, like the Mycobacterium bovis or the Avio intracellular. Because they're acid-fast, there is the method that you can use to stain with carbofuchsin the Mycobacterium, which are shown in pink here in this picture. So that's the Mycobacterium. And the cells in blue are other cells that are not the Mycobacterium broad. They have a 20-hour generation time, which means what? It takes them very long to grow. Another thing that is important about, so they don't grow well in vitro, which makes everything more difficult when it comes to diagnosis and studies, right? The Mycobacterium also has, because they're acid-fast, that means they have mycolic acid around their cell walls, and it's like a sticky, waxy substance that helps them attach to the to our epithelium, resist to drying conditions, and resistance to antimicrobial. Antimicrobial are not usually able to penetrate the bacterium to act on them because of the mycolic acid capsule. This disease is transmitted by droplet, person to person, and the bacterium usually attacks the lungs, but can also attack any other part of the body. You can have tuberculosis in the kidney, in the spine, in the brain, so not just in the lungs, okay? Not everybody infected with TB becomes sick, so some people are asymptomatic. There are 2 related conditions with TB. You have latent TB, which shows no symptoms, no transmission, but the person has a positive tuberculin test. We're going to talk about this test in a minute. 10% can develop TB if untreated. So when you have latent TB, it needs to be treated, even though there's no symptom. And you have the TB disease, which is when the bacteria become active, right? This is the one that without treatment affects between 5 and 10, well, no, that was latent. This one has a much higher risk of transmission and is more lethal than the latent TB, okay? So higher risk in immunocompromised patients such as AIDS patients. You have a number here, 8,900 reported cases of TB in the US in 2019. That is a rate of 2.7 people per 100,000 people, okay? and up to 13 million estimated number of people in the United States living with the latent TB, which means they can transmit, but they can in the future develop the disease. There are 2 videos here about TB that I'm happy to know if you watched it and how they spread, but we're going to talk a little bit about the pathophysiology of the disease here, how it happens. So here is an alveolar macrophage. Where is that? Inside your alveolus, right? And that bacterium that comes in contact with the alveolus through the respiratory path, so that mycobacterium gets here, you see, and the macrophage ingests, phagocytizes the bacterium. Problem is, mycolic acid makes this bacteria resistant to phagocytosis. So the bacterium keeps multiplying slowly inside the macrophages, and then other macrophages infiltrate from the capillaries to the alveolus and will continue to phagocyte those bacteria that are multiplying in that area. So the mycobacteria infects other macrophages that keep growing there, and then those are surrounded by a bigger, even larger number of macrophages, and that makes a center. So this is like the center of the lesion, and that's the surrounding, right, with macrophages. So the center of the lesion is when these macrophages start to die because the bacteria keep growing, right? And that's what causes, keep this name in your mind, what is called a caseous center or a caseous lesion, and that is what leads to necrosis. Okay, so this becomes liquid, and you start to have death of the tissue here, and that affects that alveolus. And with that liquefaction of the center of this caseous lesion, the bacteria have a tendency to leave. They leave that alveolus and migrate to another alveolus. Okay, so that's how that granuloma, you can call this a granuloma, can spread to other parts of the lung. And that's how the disease grows. When you use antimicrobials here, the antimicrobials need to be potent enough to break into the caseous center so they can attack where the bacteria are and interfere with mycolic acid synthesis. So the bacteria can stop producing mycolic acid, and that's what kills them. Okay, so the antimicrobial can act. So the tuberculin test that I was telling you about is a test where you use a little bit of the tuberculosis bacillus and you inject it in the subcutaneous, and that will cause a delayed hypersensitivity reaction or a type 4 reaction. Remember that type of reaction that happens with T cells. So T cells react with these purified proteins. It's actually broken mycobacterium that they use. So it's like a soupy thing with broken parts of the bacterium that your immune system recognizes under the skin of your arm, of your forearm. And you can measure the size of the lesion, and that's what's going to define if you're positive or not positive for the test. Usually the patient needs to go to the clinic to get the test the first time to get injected, and after some days for the professional to see the results. A positive reaction means that you either have an infection or you had TB in the past, or you got vaccinated. So if you had a vaccine, if you are sick with TB, or if you had TB, you're going to have a tuberculin positive test. Okay? Other ways to diagnose are X-ray, CT exam, acid fast staining, very important, of the sputum, and culturing bacteria, which is a slower process because they grow slow, to confirm TB. There are other tests that are more related to nucleic acid and presence of interferon gamma that can also give a higher specificity to the diagnosis. 10 million people develop TB annually. 2 million people die. 1/3 of the world population has latent TB. 1/3. Think about that. That's a high number. It's the leading cause of death for HIV patients or people that developed AIDS. The BCG vaccine is very important in controlling the disease, and it has live attenuated Mycobacterium bovis, which is a more avirulent form of Mycobacterium or species of Mycobacterium. This vaccine is not used in the United States because there is questions about the effectiveness, but it's used in other countries. The CDC recommends that children get vaccinated with BCG only if they're considered to be negative tuberculin test or who are continuously exposed to TB. Okay. Adults that were not correctly treated or ineffectively treated with TB also should get the vaccine, or that have TB that was caused by strains that are resistant to the drugs that treat TB, which are isoniazid and rifampin, and healthcare workers. So all these people should get the vaccine. Okay. All right, let's talk about bacterial pneumonias. We have typical pneumonias that are usually caused by S. pneumoniae, Streptococcus pneumoniae, what we call the pneumococcus. Atypical pneumonia are caused by other microbes. Lobar pneumonia infects the lobes of the lung. Bronchopneumonia can infect adjacent alveoli in the lung, and also affect the bronchi. And pleurisy, which is inflammation of the membranes, right, that are around the lung. Symptoms of bacterial pneumonia are always cough, fever, difficulty breathing, and are more common in the very young and the very old, and people with pre-existing health problems. When you use X-ray, you can see the difference between them. Anywhere that is more white means there is a higher probability of you having pneumonia. So in the bacterial pneumonia, you can see there is less whiteness even than when you look at the viral pneumonia. Okay? Even though they all look cloudy, right, in the lungs. You see the difference between the black background here and the whitish background here? So that's what they look for. One of the things they look for. So the pneumococcal pneumonia is caused by strep pneumoniae, and it has a very thick capsule. So that capsule, this is just a different stain or something that we don't do in the lab, or maybe it's just computerized color that shows you the capsule in blue, but usually we see capsule in white, right? So these are gram-positive encapsulated diplococci, okay? Spread by respiratory droplet, they infect the alveoli of the lung, increase the fluid, the inflammatory fluid inside those alveoli, presence of RBCs, so that's why the sputum of patients with pneumonia has blood, okay? So that's one thing that makes it important in the diagnosis too, if there is blood in the sputum, which is right here. It is prevented by the conjugated pneumococcal vaccine. So the vaccine has the capsule conjugated with some toxins that increase the ability for the immune system to recognize them. Because remember, capsule is sugar, and sugar has low immune response to it. So you increase the immune response or the strength of the response by conjugating it to a toxin. Remember that also S. pneumoniae can cause ear infection, sinus infection, meningitis. It can cause other diseases, and bacteremia. So that's where it becomes dangerous, right? Bacteremia, if it causes sepsis or if it causes meningitis. That's why pneumonia needs to be treated. Mostly The risks include younger than 2 years old and older people, or people with cochlear implants, cerebrospinal fluid leaks, and adults that are 65-year-old or older are all with risk. Mostly smokers and also immunodeficient patients. With the use of the pneumococcal conjugate vaccine, there was a very important decrease in the invasive pneumococcal disease from 100 cases per 100,000 people in 1998 to 100 decreased to 9 cases per 100,000 people in 2015. You see how vaccines work? They absolutely work. That they're so important for our existence, right? And the invasive pneumococcal disease caused by 13 serotypes were covered by the PCV13, which is the vaccine, and decreased the number of cases from 91 to 2 in 2015. So it is very important for us to always appreciate how vaccines are our salvation when it comes to infectious diseases. And the more people get vaccinated, the more we're close to herd immunity and even eradication. Haemophilus influenza pneumonia. So this is another type of pneumonia. The microbiome of the nose and throat contain Haemophilus influenza, so they can already be there and just start to overgrow, or you can get them from somebody else that is a carrier by respiratory droplets. The symptoms are similar to the ones with pneumococcal pneumonia, and the risk group here are children under 5, adults over 16. The Hib vaccine can reduce the incidence in children by 99%. Okay, so super important to vaccinate. Other types of diseases caused by Haemophilus influenza are bloodstream infection, meningitis, epiglottitis, cellulitis, which is a skin infection, and arthritis. Okay. 53% of the pneumonia cases had bacteremia also in 2018, and 7% had meningitis. So there are high risks of complication. Okay, very important that you treat these conditions. All right, legionellosis, also called Legionnaire's disease, and is caused by Legionella pneumophila. This bacterium is aerobic and gram-negative, right? Grows in water and air conditioning, biofilms, and waterborne amoeba. So what is this? You know how you have those towers of cooling water for like really big companies, big buildings? You know, the cooling water from the AC has that water, it has a stream, and that stream is kind of warm, and they like to grow in that type of water. So think about a big building like a hospital. If they don't replace these systems, the water in these towers, and they don't clean it, you have Legionella growing in these towers. And as the AC spreads the air, and it spreads also aerosols of Legionella. Okay, so that's a very typical nosocomial infection when this type of prevention by cleaning the cooling towers is marginalized, right? Decorative fountains, hot tubs, you see here, water for showering, all this can have Legionella because they grow as biofilms inside pipes, on surfaces. Okay, anywhere that you have a stream, you can have Legionella growing. There is no vaccine for Legionella. The disease is characterized by high fever and cough. And the Legionella has a tendency to grow and multiply inside amoeba, and then they learn how to grow inside macrophages because they think the macrophage is an amoeba. So that's how they infect our lungs. Okay? There is another disease called Pontiac fever that happened for the first time in '68 in Pontiac, Michigan. That is caused also by Legionella, even though it's a different disease. Pontiac fever is milder, self-limiting. It doesn't cause pneumonia, but it's more contagious. 90% of the exposed people can get it versus 5% with legionellosis. Legionellosis is not very spreading. It's a low percentage, but can still spread by aerosols, okay? But it's not transmitted from person to person. It's less contagious than the Pontiac fever, but it's more serious, okay? Okay, guys, we are done with bacterial diseases of the lower respiratory system. Next video, we talk about viral and then about protozoal diseases. See you later.